Hello everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Today my guest is Dame Claire Bertschinger. She spent many years working in disaster relief, mainly in war zones with the ICRC. She has an honorary fellow from the Dalai Lama Center of Compassion and many awards, 5 honorary doctorates. And Claire, you're the course director of the Diploma of Tropical Nursing for the London School of Hygiene and Tropical Medicine. Welcome to my podcast.
Thank you very much for inviting me. So, it's Professional Diploma of Tropical Nursing. Is that what you said?
That's right. I have to put a professional in there as well. Yeah, absolutely. I keep using DTN, but I know officially I'm supposed to be putting PDTN. So
yeah, that's an administrative thing we had to put in. Oh, don't ask me why.
So is there going to be some fisticuffs coming my way because I don't put the P in front of the DTN?
No, I always forget as well.
How long have you been the course director?
I've been the course director. I started in 1997.
Wow.
And I was in, and I had 2 years off in between. So since then, but with 2 years off in the year 2000, something like that.
So did you design this? Is this yours from the very beginning?
Not exactly, no. I used to lecture on the tropical diseases. It was called a certificate. And then this was developed from there. So I was one of the advisors for this course, Diploma at the London School of Hygiene and Tropical Medicine.
Wow.
And then I've developed it from there. I mean, it has actually developed tremendously, changed and moved forward in as much as getting people who are now have to have a degree before they come onto it. So it's really highly qualified now, highly recognized throughout the world, non-governmental organizations, you name it.
It is world recognized. I was in Kilimanjaro Christian Medical Center years ago, and there were DTNs showing up. Sorry, PDTNs there, as well as doctors who are doing the Diploma of Tropical Medicine and Hygiene. That was my first experience, and the level of professionalism that piqued my interest.
Yes, throughout the world, I can arrive somewhere and they've done my course. I keep meeting people who've done my course.
I can imagine, yeah, 25 years. And now you've made it online, which opens up the world, doesn't it?
It's one of the positive things out of COVID. Within a week of COVID hitting us and having lockdown, we had to go online. And although at first people were a bit worried about how it would affect the course, it's actually, as you say, open to the world. Before that, because it's a part-time course, 1 day a week on a Wednesday, before that people had to come to London, so they had to be within commuting distance. And they might have been in Europe and commuted on the Channel Tunnel or flown in from Ireland. But nowadays they don't have to commute, and I'm touching the world, whether it's Gambia, Ghana, South Africa, Australia, Canada, New Zealand, Bangladesh. I've got students in Sudan, I've got students in Niger, you name it. It's absolutely amazing. And of course, now that mobile phones are more common than out latrines, more people can access it.
They can indeed. That no one has a normal phone in most of these countries.
No.
And they have connections faster than we have in Ireland. I mean, Ireland,
yes.
Mobile coverage is rubbish, but that's been a profound change. And I was on the first program that was all virtual. The program before mine, you had to do half and half, didn't it? You started out, and that must have been a challenge.
It was a challenge. I had got the foresight to one of my lecturers, because they're all top lecturers. He was on with the World Health Organization, and he'd just flown to Geneva for the day for a big conference about what was happening with COVID. And he flew in and he arrived to give the 5 o'clock lecture, and he gave the lecture. And just before I said, so what's happening? Are we going to be locked down in Britain? And he said, yes, give it 2 weeks. By Easter, we'll be shut down. Wow. So I went back to my office and started to learn about this thing called Zoom and how to teach. And within 2 weeks, so when we were locked down on the Sunday, on the Wednesday, we were online.
Wow. That is profound flexibility.
Well, you learn flexibility when you're in the field, don't you?
You do, yeah.
You do. So all of a sudden, you haven't got water. Well, you probably haven't got water anyway, or the electricity goes out. Well, you still have to continue with the operation or cleaning wounds, don't you? And you adapt.
I suppose learning Zoom is easier than trying to find clean water for cleaning wounds. But
well, I wouldn't say that IT is the most easiest thing for me.
well, you guys made it happen. I was so impressed. This is what I do. I teach online. I teach classrooms in Malta, and I was so impressed with what you're doing and with the lab work with Claire, and you are world renowned, and you learned it on the go. That's really impressive.
We did. And we tried to also make it friendly and relaxed as much as possible, which is not always easy, but I hope we went some way in doing it like that.
I did see that. And the WhatsApp group is still active in my cohort. And I'm hoping each group does a similar thing with the connections and lifelong connections. Yeah, that's profound. So tell me a little bit about yourself, Claire. What's your experiences in austere medicine? How did you find yourself course director of the DTN?
Yeah, well, gosh, I've had quite an eclectic life, but I always wanted to be a nurse. I trained as a nurse, and I specialised in accident and emergency. I knew I wanted to work abroad in a resource poor area, so I did the tropical nursing course, and then I was going to join a refugee camp in Cambodia, and 2 weeks before I was about to leave, the place was completely leveled to the ground by bombing. So I had nothing to do. So I found myself sort of taking a train around Europe with another nursing friend, just because I had nothing else to do, and ended up with some relatives in Switzerland who said, why don't you join the International Committee of the Red Cross, the ICRC? With your background in accident and emergency, tropical nursing, you'd be ideal for that. So I arranged to have an interview a week later. And in that time, because I knew I had to learn a bit of French. And so my family out there taught me parrot fashion 10 phrases in French. And the one particular phrase which was important is, if you don't understand what they're saying, just answer, je donne le meilleur de moi-même quand je fais face à un défi, which means I give the best of myself when I'm faced with a challenge. So, whatever they say, if you don't understand, just answer that one. And a month later, I found myself in Lebanon, in war-torn Lebanon. That was in 1983, during the Shuf Mountain War. I've forgotten one thing before that. I actually, straight after nursing, I went on, I was in America, dead-headed cars in America, around America with a friend of mine. And then went on the expedition Operation Drake in Panama, Papua New Guinea, and Sulawesi. We worked in the tropical rainforest where they were doing scientific research, and I was the medic on that one, which I just loved.
Wow.
But I didn't just wait for the injuries to come in, because that was boring. It was just, diarrhea and things, nothing really exciting, as you might say. So I used to help the engineers build a walkway, a scientific 100 feet up in the jungle canopy where they could study the flora and fauna. So I did that for 18 months. So I found myself in Lebanon, and in Lebanon with the ICRC, my role was based in south of Beirut in a place called Saida. And at that time it was controlled by the Israelis. And in any one day I could cross the front line between Israeli-held areas, Sunni Muslim, Shiite Muslims, Druze militia, Christian-held village or Palestinian camp, and then back into my home territory, which at that time was in Israel. And although each time you had to cross the front lines, you had to arrange ceasefires. And you might say, how did you do that? Well, I did it under the protection of the Red Cross, but it's not quite as easy as that. You first of all have to arrange ceasefires at the very high level, which is in New York, Paris, London, and Beirut, or wherever the head of each fighting faction is. And then I can remember the first week I went up to the front line, you stop the vehicle or the ambulance that you're in, you get out, and I've got to meet these fighters who sort of come out of dugouts in the ground. They're filthy dirty, they haven't eaten much, they're cold, they're covered in bullets and grenades and they've been shooting, killing people, they've got blood on their hands. And I think, well, how am I going to ask them to arrange a ceasefire? This, just me, a little woman. And what hit me when I started talking to them is they started talking about wanting peace. We're actually fighting for peace, Claire. We want peace. It's those over there that the baddies. They're the ones who raped my wife, who razed my village to the ground. But we're good people. We want peace. And I found this really bizarre, this dichotomy between killing and torturing and wanting peace, fighting for peace. And eventually we arranged a ceasefire. They were usually several hours, between say 10 and 12, don't fight, shoot in this particular area we're going through, and cross the front line, which, as many of your fellow students will know, could be anything from a few hundred yards to a few kilometers wide. And to the other fighting factions who are the killers. And what do you find? You find these really nice people who, although, yes, they've been shooting and wanting to kill people, they actually want peace and they're fighting for peace. And wherever I went, wherever it was different fighting factions, often it was due to some sort of religion of some sort, faith-based. It was encouraging them to fight, that they wanted to have peace. And at that time, that's what made me think there has to be an alternative to war. But what is it? And that's when I started thinking about alternative to war and becoming a Buddhist. But I'll talk about Buddhism later, if you want to. And then after that, I found myself in 84, 85 in Ethiopia during the famine, which many of your students won't know about, but many will. And that's when I was again in a conflict area in the great north of Ethiopia, Tigray province. Lots of fighting, but I was there to set up a feeding center because there was no way any other relief organization was allowed in at that time. It was a communist regime at that time. Mengistu Haile Mariam was the president, and he wanted to celebrate his 10th anniversary being on the throne, so to speak. So he celebrated it, and he invited journalists into the capital, Addis Ababa. But the rest of the country where I was, people from the outside could not come in officially. We were in the village called Mekele, surrounded by the TPLF and the other fighting factions. And all these displaced people were coming in, starving, hungry, no food. And I can remember that one day there was outside my feeding center, I had 300 children at the time who got 3 meals a day. There was 10 lines of children, and in each line there was over 100 children. That's over 1,000. And I had space for 60 or 70 new children to come into the feeding center. But I only had, I knew all of those were malnourished, and we didn't take the ones which were severely malnourished because we knew they would die within the next few days. So we took the ones which sort of had a spark of life in their eyes, and we knew the rest would die within a week or 10 days. And that was the most horrendous situation that you can find yourself in.
Wow, that's a tough choice.
Mm-hmm. And then from then, oh gosh, where have I been? I did some time working in Switzerland because I knew I had to learn French. So I chose a hospital nearest the ski slopes in a place called Sion. And so the ski accidents and the avalanche victims flew in by helicopter on the roof from Zermatt or Verbier or Crans-Montana. And that was really exciting, and I learned a lot there, a bit different from tropical medicine. And then I found myself in Uganda, and I spent a year, and then I spent a year in Afghanistan with the Mujahideen as well, doing the same thing, crossing the front line into the main fighting area. So at the time, Kabul was controlled by the government and surrounded by the Mujahideen warlords. And I was the field nurse who crossed the front line each day to get to a first aid post. It's about 25 kilometers north of Kabul. And again, I had to cross 12 warlord, different fighting factions. They were all Mujahideen, but they have their own area. So you had to arrange ceasefires again, often with shells falling all around and some patients crowded into the ambulance, which was then was a Toyota Land Cruiser, an extended one. And I can remember one day we had 12 in one Land Cruiser. And although there's only 2 stretchers, each stretcher held 2 people, head to toe. Any small children were held in the arms on those on the stretcher. And I had 3 chest wounds who sat up front with me, even though there was only 2 chairs. We had 3 people. Wow. They sat them up. I'm not proud of that, but we had to get them out of the area because we never knew when we could arrange another ceasefire. And they were all really severely badly wounded in some way, whether they had their legs amputated by landmine or shot at or shells, shell injuries. So so I did about 10 years on and off with the International Committee of the Red Cross. And I left in 94. I spent 2 years in Geneva as the training officer there. And that's when I came back to Britain and decided to do a master's degree in medical anthropology. And then I got the job at London School of Hygiene and Tropical Medicine. Done a few other things in between as well, of course. That's
amazing. You've been in places where military would find it difficult, and you were there as a peacekeeper and as an example of non-combatant, the power of non-combatant. That's really impressive.
I think that's important to realize that I was in war zones just like somebody holding arms, a military person. And in fact, I was probably more in the front line than most military people that have ever been. In fact, I was told that by some of my military friends. Do you realize you've been longer in the front line than any of his fellow military people he knew? Because you're literally in the middle of it.
Definitely. The majority of combat vets have not seen the combat that you have.
And now with drones, which is the way forward, and lasers, and what else am I going to say? Satellites and all that. Killing people is going to be even so much easier because you can't see their
I have
eyes.
Friends in Ukraine at the moment, and they're having that issue. It's all drones.
Yeah.
At the moment, but that's another conversation. So you transitioned into teaching. So tell me about the DTN and your experience with London School.
Okay, so the London School of Hygiene and Tropical Medicine, yes, we teach theory, but what I realize is that you can learn only so much theory, but then what happens when you're in the field, you've got a cholera epidemic and you've got no running water and no electricity and no antibiotics? How are you going to survive? Well, I can come along and say, well, actually, when I was in Ethiopia, we had this cholera epidemic. We had exactly in that situation, and this is what we did. So we survived. So I can give the practical side of working in a resource-poor situation. Majority of, nearly all my lecturers have had field experience as well in resource-poor situations. And that's what makes it so interesting and so vital to learn from them as well.
I did notice that the caliber of people you brought into my DTN experience was top notch. Everyone had recent clinical experience, which was fantastic.
And I think what's fun is that all these different personalities, which is just like real life, and you get some of them that might study the life cycle of trypanosomiasis, sleeping sickness, and they know every little bit about the life cycle and how it's going to affect it. And they just, when they lecture you, they just ooze enthusiasm about their lecture. They might be a bit dry in talking, but they just love their disease, their infection.
It definitely comes out in their passion. Their passion comes out. And Claire Rogers with the lab is a prime example. The absolute passion she has for her work is you can see that easily. And she's lasting impression in my experience with that. That was fantastic. So the DTN was originally aimed for bachelor's degree nurses. What made you decide to accept paramedics, and how has that been for you?
So I've been doing it, as I say, for 25 years or more. So the difference when we started, paramedics didn't have to have a degree at all. And in fact, I don't know about in Germany, well, I know still in many countries, they just scoop and run, aren't they, to the hospital?
A lot of
Some
them.
countries, they're part of the fire brigade and or the police force. But nowadays, in Britain and in many other countries, definitely America, it's been for a long time, they have degrees, they're highly qualified in doing advanced first aid, as I'm going to call it. And so I know in the field, in a war zone in particular, but any time, refugees, earthquakes, they are better, I shouldn't say this, but they're better than nurses because they're used to working on the ground without running water, without electricity. They're used to improvising. So it was a very easy step for me to realize that they also needed a lot of detailed information about the different diseases and infections. It wasn't difficult for me to decide that as long as they've got a degree, yes, we must take in paramedics as well. Paramedics is actually the way forward to become a paramedic in a lot of healthcare situations nowadays. In Britain, in doctors' surgeries, well, I know some who work in hospices even because they can assess the situations a lot easier. It is equally qualified as nurses, and when they go on to do masters and PhDs, hey, they're doctors. They get a doctorate, they get master's degrees. They are polyvalent in many, many ways.
They are. In Britain, there's the Masters of Advanced Clinical Practice, where it's a nurse or a paramedic that they're now equal, and they're doing the same program of the ACP.
Yeah, absolutely, absolutely. And they get a good salary as well when you get extra.
They do indeed.
Patients.
I've seen some dual programs, so you can get a nursing and a paramedic license from a bachelor's degree program, and I'm wondering if that's the way forward to have the best of both worlds.
Absolutely, good idea. How long is that? 3 years only?
No, that'll be 4. Yeah. Australia was the first one to do that, and I'm starting to see it elsewhere. You nurses have vast experiences that we need as paramedics. So yes, we're good at pre-hospital, but you're good at patient care, prolonged patient care. If I had to do it over again, I would have started as a nurse, and I'd probably be a better paramedic today if I had done so. But
I'm sure you're great anyway.
My passion is to give people the option, regardless of paramedic or nurse or doctor. So the DTN has been a profound shift in my path, my own life path. And I want to thank you personally as a course director and the one to put this into motion. And I guess as an educator, I'm delighted to see what you've done with the DTN. And my question would be, where do you see it in 5 years? So you've brought it from 1998 to where it is now. And it's obviously the word professional in front of the DTN makes sense because you've made it that good. But where do you see the DTN going in 5 years or 10 years?
What would be lovely, because we're online, it would be lovely if we could do a bit more, maybe week practical in certain areas. Now, I know Claire Rogers, and I agree, would love to do maybe a week at the London School of Hygiene and Tropical Medicine, something in laboratory, so that you've got the virtual online when you're studying for the course, but you can also do, say, 5 days in London. Or it's also possible, she teaches also in Gambia and in Moshi. So it could be maybe somewhere there where the alumni of DTN could come and do a week's course. We'd also like to extend the course to doing it based in another country, maybe. We are moving forward to try and find more LMIC lecturers who are actually based, because at the moment we do tend to have, for instance, measles, and it's somebody who works in London, he is a consultant, but we're looking at finding someone, and we have found somebody actually to do measles, and they work in, I won't say, well, they work in a medical research council in Gambia, and so they'll be doing the lecture next time. So we are looking for people, for lecturers, highly qualified with a little sense of who can teach well, not just spurt out, but also empower their students. And so I see myself using more and more highly qualified lecturers from around the world, not just from London.
That'd be brilliant. And I would jump at the 5-day option in London School, and probably not just once, maybe have it as a every 2 years, just it's time to come back and
absolutely
redo those skills that I've lost.
Now, yeah, and there's another thing which I have actually put forward, but for the last 3 or 4 years, and that is a master's in tropical nursing.
Wow.
My idea forward would be that they would do the DTN, so it's starting in September. They would do the DTN 1 day a week up until March, but also do a master's linked to infection control or global health at the London School of Hygiene and Tropical Medicine. So they'll be doing 2 of those courses to the end, in a year. So it'll be the PDTN and a master's course. Now that's what I've been trying to put forward.
Mm. And would the master's degree be called tropical nursing? So it's
a master's in tropical nursing.
Yeah,
yes.
so MTN. All right. I would definitely look at that as an option.
Yeah. Oh yes, it's so many people have said they would love to do it, but getting that up and running has not been that easy. And of course, with COVID, everything's stuck. Yeah.
The amount of work to get a master's up and running is, we've got 2 of them now, and it's 3 or 4 years of just living hell trying to jump through the hoops. So I appreciate what you're going through on that one. So Claire, we have paramedics, docs, nurses, physiotherapy. We have tons of people who listen to this in all 7 continents. So one of our graduates is currently in the Antarctica. Steve Nacy is down there. But my last question for you is what advice do you have for all these people who are passionate about austere medicine and tropical nursing?
Well, my advice is to keep on training, to keep on educating yourself. I'm not seeking extra students because I have a waiting list already. But if they have not done tropical nursing, it is a way of increasing your knowledge and giving you, extending your mind in how you work in resource poor areas. The lectures on infectious diseases are really quite detailed, and that will help you understand more clearly about the infection. And coupled with the virtual laboratory, again, although the majority of students who do our course don't use the laboratory, it does help enhance the learning process of individual infections.
Definitely.
And diagnosis of malarias and helminths and things like that. I think you just have to be the change you wish to see. That's what I say, and keep education. We'll take allied medical professionals. So if they are physiotherapists and they are working in an LMIC country, we would accept them. Depending on, I tell you one thing is, the applications are very badly written. Some people, I mean, please give me details. Normally when you apply, you just throw down all your experience of your training. But what I need to know, because it's tropical nursing, is where you've been, languages you've learnt, challenges you've had, not necessarily whether you can put up a drip or give IV antibiotics or done CPR, which is pretty useless in a resource poor area. But so be careful when you fill in. You don't have to write hundreds of words, 200 words or anything, but just give me a bit different idea, not just it's your passion to work in LMIC, but how you're going to use it.
So are you using that application essay as the basis for your acceptance?
It's not an essay. It's just give me a reason why you want to do it. And most people, it's the same, I shouldn't say this, boring thing. I've always wanted to work in tropical countries. Interesting ones are, I was working in such and such a place and realized I didn't know the infection, what was happening. Other ones, again, tell me about your languages, what languages you might speak. Tell me about where you've worked. Some people say, oh, yes, well, I haven't done much. I spent about 3 months in Uganda, but I didn't really do much there. Well, actually, 3 months in Uganda was a very good grounding.
Yeah, that's impressive.
Yeah, I always have to, people are very reticent about saying about their experiences. Perhaps it's a British thing. I think it's true. I think Americans are much better at selling themselves.
And maybe too much at the other end of the scale.
Yes, too much sometimes.
Yeah. I'm hesitant to remember what I wrote on that block, but it worked. I don't know what happened, but you accepted me on. Thank you for that.
No, you had a lot of experience. Military, people who've done the military are very good as well, you see. It's not a negative thing, it's a very positive thing to work in. And ICRC, although they work in peace, it's about working in war zones and it's about Geneva Conventions. If you've been in the military, they like to have people who've been in the military and understand the other side of war.
Yeah, it's a different reality, and I would like for people to have both sides of the understanding. You don't have to be in the military to understand conflict, but you do. I mean, Claire, you were there with bullets flying. You were there with, I can only imagine the risks you took in the last 35, 40 years. But there is a lot of experience in that, regardless of carrying a gun or not. And you have so much of my respect for what you've done, the path you've walked in this life, and the influence you have and the lives you've changed. I really appreciate that.
Thank you. Thank you. Well, it's been my joy. I've enjoyed it. Oh, I've got one other thing to say, and that is when you're looking for work, for instance, at this very moment today, I saw an advert for ICRC who wanted security advisors. Now, many of your paramedics who have so much experience that they would be ideal for security advisors. So when you're looking for work, don't just look for paramedic or nurse or physio. Think a little bit outside the box and I would also say don't wait for an advert. Put yourself forward as adaptable person and what might you have available for me. The thing is to get past HR. You have to tick boxes. I have, and I've done this myself, is arrange an informal interview. So fly over to Geneva on a cheap flight for one night. But before that, you arrange, can I just have an informal interview with, and you see the head nurse or the head paramedic or the head of medical health division, stay at the youth hostel for the night, so it makes it cheap, and fly back the next day. But you put your foot in the door, you've spoken to the person, you found out they've seen you and what you can do, and they can give you an idea of what sort of post you might be adaptable to work at.
That is a very good suggestion I hadn't thought about. And our paramedics who are looking for that first job, the first one's tough to get in. That's a really good idea, to just get face-to-face. So many things are face-to-face, or even if it's virtual, on personalities and world outlooks that you can do by doing this instead of just on a piece of paper.
Yeah, piece of paper just goes to HR, you see, and HR, you have to tick so many boxes.
That's true. And they look at that and say, oh, you're not a nurse, so throw that in the round bin. But hopefully more and more paramedics will get to do that face-to-face interview. That's brilliant. Claire, thank you for your time, and I really appreciate the chance to do this interview. It's a profound honor.
It's my pleasure to do it, and you were fantastic students. And since you've come along, I've had 3 or 4 other students. I've got 3 at the moment on my course, and they really add something a little bit extra to the course because of their life experience. So they help teach the other students, and they will learn, they network between themselves. So please do get your paramedics or your physios, or I've even had a veterinary surgeon on the course. Who,
that's great.
She didn't want to do the doctor's course. She wanted to do something. And it's so as long as you've got a degree and you're in an allied medical profession, and you can always, your people who know if you want to apply, you can also email me directly and for advice. I'll be careful now how many emails I get.
Yeah. Well, we'll keep that email close to hand, but if anyone wants it,
Unfortunately, it's out there. It
is. Fair enough. Thank you very much.
No, lovely to speak to you, Brick, and to see how you're getting on. Good luck with everything. You're doing a fantastic job yourself.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is Corum, C-O-R-O-M, corum.org.